Hello and good afternoon. Welcome to our webinar hosted by the Ontario Network of CAPC CPNP projects. And we're here today with Lisette Dufour, and our topic is prenatal and early childhood oral health. So we're really glad that you could join us. My name is Sydney Bell. I'm the program lead for the Ontario Network of CAPC CPNP projects, and I'm really delighted to be here. If you're new to Zoom, I encourage you to make sure that your microphone is on mute and not have your video on, but to find the chat function and type in and say hello. We'd love to hear from you and hear where people are logging in from. Before we begin, I would like to offer a land acknowledgement. The Ontario Network of CAPC acknowledges and thanks the First Peoples of the territories where we work and serve, and other Indigenous peoples for sharing this land in order for us to come together today. So if you, again, have questions or comments, please feel free to type them in the chat function, and I will gather them up. And Lisette has asked that we will have the questions at the end of the webinar. So I think now we are ready for Lisette to take over, and she will also introduce herself and take us through her information that she's sharing. So Lisette, hello, and over to you.
Thank you, Sydney, for actually inviting me over so I can have this great chat on the importance of early childhood oral health. And I'm specifically happy to talk to you guys because I am a French Canadian, but also from Ontario, born and raised in the North. So I'm glad that finally we can have a chat with Ontario. As you know, I'm from the Office of the Federal Officer, and this is within the federal government public health agency. So today I wanted to just get a glimpse for you so that you can understand why it's so important to discuss oral health when you guys are delivering your program. So we're first going to go through the burden of oral health disease in Canada. So in terms of tooth decay and in terms of dollars, how much are we spending in Canada? So we also are going to go through the effects of poor oral health, and also from a common risk factor approach. When we have poor oral health, how does it affect the rest of the body? We also want to chat, whenever you guys would talk about obesity or you would talk about diabetes, it's also great to integrate oral health within that, because if you do some good for those chronic disease, you would also do some good for oral health and vice versa. And I have some resources that we have worked on, so I'll be more than happy to share those as well. So thanks again, and Elliott Lake. This is so nice. I don't deliver webinars through Zoom too often, so it's actually kind of nice to see if you want to drop in a few lines at the same time. So it's great. So the Office of the Chief Dental Officer has been established back in 2004, but in 2010, we moved to Public Health Agency, and we now have an official mandate, but it's more to advance population health, and particularly the oral health, and trying to promote disease prevention and also provide technical guidance to a lot of people across Canada, but also across the world. We also have a network in the world as well when we talk about it. So you'll see that our 3 pillars up there are exactly what we were talking about. We need to provide some leadership so that if the province of Ontario and Nunavut would share the same concern over oral health, it's kind of our job to join everybody together so that we don't duplicate resources. So this is through the leadership of the federal government that we're able to do all of that together. Most of the resources that we have, all of them are based on evidence as well. So we don't have a lot of resources at home. We're actually a directorate of 4 people. When you talk about other centers, there are 100 employees, we're just 4 employees. We have the Chief Dental Officer, we have myself as a registered dental hygienist, we have a policy analyst, and we have an admin person. So that's basically all of our shop. And we also will talk about integration because, as you know, because the limited amount of resources, we need to integrate with our other programs in order to get our policies and get our messages through, because we don't have and we don't own any program. If you guys have any questions, please stop me as we go, because sometimes we forget our questions, and it's easier actually when we go through the questions at the same time. So here, let's talk about money a little bit. So actually, oral health is the second largest privatized piece, okay, in Canada. So we spend close to $14 billion in oral health in Canada. It's quite a lot of money. It's the second one, the first one being medication that you purchase through either prescription or over the counter. So this is a lot higher, but that one is, people are kind of impressed to hear that we spend so much money. Why? Because it's privatized. The hospital, the Canada Health Act, will talk about the body and the health of the body. However, it seems that the mouth is external to the body. This is the reason why that people have to go through private dental clinics and get their services there. Either they pay out of pocket, or they have some private dental insurance, or they have employee-sponsored dental insurance. So it's actually the reason why this is so high. So oral health in Canada is, it's actually dental. Let's talk about tooth decay, because tooth decay, actually basically everyone has experienced tooth decay in Canada. The 2007-2009 survey of the Canadian Health Measure survey told us that 96% of Canadians have experienced dental decay. But tooth decay is like 5 times more common than asthma and 4 times more common than obesity. Yet we don't even have a big national program to talk about this, because it's not part of the body. So hence the reason that we have to piggyback on other programs to discuss oral health when you guys are talking about obesity, cardiovascular issues, and all of the other chronic diseases. So let's talk about the leading cause. So in Canada, some kids do have to go general anesthetic, and actually tooth decay is the #1 cause of day surgery under general anesthesia for kids aged 1 to 5. Usually it's like where we could find the highest amount of people and the highest prevalence is usually when there's Aboriginal population residing within the vicinity, and close to 4 times more surgery for the least affluent neighborhoods. So I think it was close to $21 million that was spent on the dental surgery. However, this does not account for all the surgeries that are being done in Quebec, because Quebec did not participate in that study, and all the ones that are within the private sector. So if you ladies and gentlemen had some kids that had to undergo general anesthesia in private sector, that does not even count in there. So I wouldn't be surprised that we have double what we have actually on that survey. So there are no statistical data in Canada for oral health and pregnancy, particularly gum disease. However, the US data reports to us that about 40% of pregnant women have gum disease, to a moderate and severe. We're not talking to mild, but still it's pretty high. So we have to make sure that when you plan to be pregnant, or if you think that you are pregnant, it's very important that we go see the dental office and that we deal with our issues right away. It's usually easier to have it done within the first trimester before you get pregnant, or in the third one, but you're not going to be that comfortable in the dental chair. And similar to other chronic disease, vulnerable population, of course, carry the highest burden, but I'm pretty sure that you're aware of that. And here's how it kind of works with where we share the common risk factors. So when you talk about the health of your mouth, it's linked, and the research is categoric on that. It's linked to heart and stroke. It's linked to respiratory diseases, arthritis, diabetes, gastrointestinal diseases, and preterm low birth weight babies. So it's kind of easy. If you do have inflammation in the gums, then it leads to inflammation through the bloodstream, which leads into the bacteria, and it goes back into the bloodstream. So hence the reason that this is there. There's more and more research that are being done, but when we talk about dental research and we talk about the medical field, only 10% of all the medical field, 10% is related to dental. So hence the reason we don't always have the data that we want, and there's not as much funding that is dedicated towards oral health data. We're hoping to change that, but I'm going to talk to you about this in a few minutes. So here are the effects of poor oral health. So I'm sure some of you have experimented that with some of your audiences or some of your people that you're within your program. So when you talk about symptoms and conditions, there is infection, of course, and then I'm going to talk infection about tooth decay or gum disease. And there's, of course, pain. So if there is pain, there's disturbance of sleep, and then there's withdrawal from normal activities. So we're talking with babies, and we're also talking with mothers and with fathers and with caregivers as well. Because if a baby cries all night, nobody in the home is sleeping. So people get sometimes aggravated because they don't have enough sleep. So it's exactly the same thing as any other chronic or infectious disease. When you have pain, you reduce the chewing ability, therefore you can't nourish, you can't nurture yourself, you can't eat properly. If there is a poor nutritious status, then you may have, when the infection is at the level that you can't treat it anymore, you may have to extract the tooth at an early site. So if you extract the teeth, then you're going to get problems with orthodontics. So you're going to have overcrowding, which could lead to bigger problem eventually, and probably more money if you have to undergo orthodontics as well. The social impacts is definitely the lower self-esteem and confidence. So if you are missing a few teeth, or if your gums are puffy, or if you have halitosis, bad breath, it may be very difficult to find a job. And it's very difficult within the social aspect of your area as well. So. And there are existing gaps into the babies and toddlers' access to care. So for instance, the Canadian Dental Association, so the Dentist Association, is recommending that all babies should be seen in a dental office within 6 months of the eruption of the first tooth. So usually your first tooth would come at 6 to 8 months. So that means within the age of 1 year old, you should be able to attend the dental office so that they can have a look at your teeth. And when I say dental office, I mean it could be a dentist. In Ontario, you could be a dental hygienist, and basically they will have to evaluate and make sure it's fine. However, the data is telling us that less than 1% of the kids who are age 1 have been seen by a dentist. And it keeps on going, about 2% when you reach 2 years old, and 40% by age 4. So it means that 60% of the kids, when they reach 4 years old, 60% still haven't been to the dental office. That may be changing eventually if at one point, like when I used to be a kid, in order to attend school, you had to have a medical checkup and you have to have a dental checkup. So that could sort the issue before entry level to school. So that would be a good way to do things. On the other hand, when you talk about non-dental issues, so in the medical side, so for a medical home, the kids that are age 0 to 2 have had the opportunity to visit a medical doctor or a nursing facility or a nurse or well-baby clinic 8 times before they go to school. So that, you know, when I talk about integration, sometimes it's impossible for people to go see a dental office because of the barriers. It could be access, it could be cost, it could be a whole bunch of reasons why you can't access dental care. However, we know that they have more chance to see a nurse or to see the well-baby clinic or pediatrician. That's why we're now trying to promote oral health within the healthcare system as well. I don't see a lot of questions, so I guess I'm doing a great job, or there's no one.
So we're doing a great job.
So let's talk about the common risk factor, because yesterday I was with Public Health Agency and I was giving a similar presentation to the social determinants of health, that unit, and they had something very similar to that. But of course, oral health was not part of their slide, and I thought it fit perfectly. So I said, let's give an example about poor oral health and obesity. and look at the risk factors. They are basically the same. So even by not talking about oral health, but if you guys are going to talk about obesity and what are the risk factors, you're still helping out oral health. However, it would be kind of nice to mention oral health because people don't click right away to say, oh my God, I need to take care of my teeth. I need to take care of my gums. And that actually could help out the obesity factors. It could help out the diabetes factor because one exacerbates the other and vice versa. So that's why it's so important to integrate oral health promotion resources at the same time as you would be talking about other chronic diseases. Here's the second one where I talk about diabetes, where we talk about consumption of sugar-sweetened beverages. Oh, did you guys see the new food guide that just was released yesterday? Actually, the guiding principles, like the document that's about, oh, I think it's, just a second, it's right here. So this is the 42 page right here. That was, okay, 42 page. So for the first time, oral health and dental decay is on page 4. So it took me about a year and a half to chat with the Office of Nursing, not nursing, Nutrition Policy and Planning, but we made it in there because they were having this campaign of sweetened beverages. They were talking about this and it was diabetes, until I saw a few things and I said, how come they don't even talk about tooth decay in there? So after a year and a half, they really understood the common risk factor, that it was important to talk about this. We've convinced them that there's a reason why we should be, not everywhere, but oral health should be mentioned somewhere, and we made it to page 4. So to us, that's a big achievement because it's the first time that oral health and dental decay is mentioned as part of the Canada Food Guide. What else is in there? Yeah, so these are all the common risk approaches, but needless to say, I don't really have to go through this with you because you probably are aware of this already. So let's talk about the oral health integration in here. So despite the fact that some vulnerable population are publicly insured, there's still 36% of people who still have untreated tooth decay. So you would be walking downtown and you still have to believe that 36% of people have tooth decay that has not been treated. So they walk with infection. So your programs, like such as the CAP-CCP, it's a great opportunity to raise awareness about oral health key messages. Prior to having this webinar, we also have a chat with the provinces and territories, and there's one representative per province and territory. So we make sure that when we have concerns at the national level, we ask and we share. And because we don't have a lot of resources as well, and we don't have the capacity to build any resources, we try to work together. And we're the hub to make sure that a key message for the national level should be a key message for everyone. There may be multiple factors why, no, Saskatchewan may think it's not really for them, or Ontario says, yes, it's important to talk about community water fluoridation. Quebec might say, well, you know what, Lisette, only 1% of our people have community water fluoridation, so we want to increase toothpaste recommendation. So there are reasons why we have variance in our policy, but nevertheless, we should make sure that at the national level, we say similar things and we share the similar key messages as well. So let's talk about key messages for sure. It's that we really have to promote the first visit by the age of 1. We have actually Manitoba who has said, okay, so the the Manitoba Dental Association is saying that they will see the kids before they reach age 1 for free. So that was an initiative that was undertaken by Manitoba in dental offices. I'm not sure how it's going. However, I know that it was a huge achievement for the Manitoba people. So we're trying to tell other jurisdictions to say, hey, this is what Manitoba is doing. What about you guys trying to do this? But sometimes there's no appetite for this. Like, it depends. It's a policy and it's political. So we also want to promote oral health connection in all interventions. So CAPC, CPNP is a great opportunity to have this done. I've been to Nunavut well, less than a year ago, maybe 8 months ago. And although some of the communities really struggle, I had the opportunity to visit a small community called Arctic Bay. And we were taking my chief dental officer, which does not really have a lot of knowledge in terms of early childhood, because he's a prosthodontist and he's the retired chief dental officer of the National Defense. So you see National Defense, they don't really see a lot of babies because their main cohort are the 20 to 40-year-old, predominantly male. So he doesn't really see the kids' teeth. So we take him to Arctic Bay. Arctic Bay is a very small community. It's 3 hours north of Iqaluit. And we get there and I look and everyone's teeth has been treated, because there has been a dental therapist in there for 30 years. So the same dental therapist has been seeing the same people and their children for 30 years. So of course, there was still a lot of decay and everyone had experienced tooth decay, but actually it was treated. So it was not as bad as I had anticipated in Arctic Bay. However, it's not the same in Nunavut for all the other communities. So hence the reason it's so important to go to the school to try to establish and to try to initiate toothbrushing programs so that everyone has access to at least one intervention. When you talk about community-wide fluoridation, when you go to Nunavut, it's very impossible to establish a good community water fluoridation area. Plus, it is within the municipal jurisdiction and the communities are so small that it may not be effective. But that's just Nunavut. Like Ontario may be another different factors why municipalities should wish to undergo community water fluoridation. Toothbrushing for kids, you know, you have to make sure that mom and dad and caregivers show the kids, because the kids learn through modeling all the time. Brush good, brush bad, but brush. You know, that's basically it. We don't want to make this a big fuss about it, as long as they know that they have to brush twice a day. I'll say the 2+2, twice a day for 2 minutes with fluoridated toothpaste if your kids is at risk and whatever. And I will show you later on a Lift the Lip resource. So last year, and when we chatted with the communities and with the provinces and territories, it became pretty evident that there was no lift the lip technique, no good little video that was good. There was a little pamphlet, but you know, that was basically it. So Public Health Agency funded some money through a CAPC program in Manitoba, and Healthy Child Happy Smile, which is a great project out of Manitoba, had agreed to get a Lift the Lip video. So I don't know, Sydney, if you do have, I think we have time. So I don't know, Sydney, if you do have the link, but perhaps we could watch like 1 minute of the video out of 3 minutes.
Sure. Do you want me to bring it up, or do you have it queued up on one?
No, I don't have it. I don't have it. Sorry, I'm about to fall off my chair.
Do you want me to bring it up? Lift the Lip? Is that what I should put?
Yes, Lift the Lip video. And we'll watch it in English because we've actually been able to translate it in English, en français, in Cree, Ojibwe, and Inuktitut. So 2 First Nations language and 1 Inuit language. So it was quite an undertaking, but I think it's being visioned quite often. So no, it seems to be a successful story. So I just want to show it to you so that you guys can have a look and can use it within your program.
Sure, I've got it up on my computer, so I think you just need to stop sharing, and then I will share.
Okay.
No, not go to the top, I think, and do.
How's this?
That's good. So let's see here. Okay. Let's see. Now tell me if you see the right thing.
Yes, that's the one.
Okay, and I'll just hit play and you tell me, okay.
Baby teeth are important.
They
are needed for chewing, talking, looking, and feeling good. They hold the space for future erupting adult teeth to properly grow in place in the mouth. Good oral health in early childhood helps to set children on the right path for a healthy smile throughout their lives. Taking care of your child's teeth could start right from birth to prevent early childhood tooth decay from developing. Children can get tooth decay as soon as teeth erupt and grow into the mouth. Early childhood tooth decay can affect a child's health and well-being. If left untreated, it can lead to pain, problems with eating and speaking, tooth loss, and infection. Too many children have dental surgery to treat early childhood tooth decay, even though it can be prevented. Good oral health will also contribute to overall health and well-being. One way to keep baby teeth healthy is to lift your child's lip at least once a month to check for early signs of tooth decay. To do this, you can place your child on your lap, lift your child's lip, and inspect their teeth for any signs of tooth decay or abnormalities. Healthy teeth will be free of any brown or white spots. If you can see white spots or lines along the gum line, this is an early sign that tooth decay is beginning to develop. If you see brown areas forming along the gum line, this is a sign that tooth decay is getting bigger. If you see large brown spots and broken or badly decayed teeth, this is a sign of severe early childhood tooth decay. If you notice that early childhood tooth decay has developed or is starting to develop, take your child to a dentist right away. If your child's teeth are healthy, it is important to visit a dental office. A child's first dental visit should be before their first birthday or within 6 months of the first tooth growing into the mouth. Keeping baby teeth clean is very important. Brush your child's teeth twice a day for 2 minutes at a time. Remember that brushing before bedtime is very important. A grain of rice-sized amount of toothpaste with fluoride should be used for children 0 to 3 years old who are at risk for developing early childhood tooth decay. A child is at risk for early childhood tooth decay if they live in an area with non-fluoridated water, they have visible plaque, have white chalky areas or defects on their teeth, or if they already have had tooth decay, they may have many sugary snacks and sugary drinks. Their teeth are not brushed daily, or their parent or caregiver has tooth decay. A green pea-sized amount of toothpaste with fluoride should be used for children 3 to 6 years old. Floss between teeth once a day as soon as teeth start to touch. Early childhood tooth decay can be prevented. Taking care of baby teeth right from the start will set them on the path for a lifetime of healthy teeth. For more information on early childhood oral health, visit Healthy Smile, Happy Child's website, Facebook, or Instagram page.
Thank you so much, Sydney.
You're welcome. So I'll stop sharing and then we should be able to go back to you.
Okay.
Okay.
There we go. So I think that's where we were. Yeah. So I think that's where we were.
Wonderful.
Actually, let's just talk about the lift the lip technique, because it's actually kind of nice that you, oh, I think I've lost my little box where I see everyone. Well, nobody had asked question yet, so it's kind of nice to have this 3-minute lift the lip, because it is filled with key messages in there, because it helps. You know, taking care of baby's teeth as early as possible, you're on to something in there. You on to a better future, because they develop the good habits right away. So this is one of the key messages. Another key message was the amount of toothpaste, the fluoridated toothpaste that is required if your child is at risk. So it's very important not to overdo it with toothpaste, because then you can end up having a bit of fluorosis. And fluorosis is not a big issue in Canada. However, you may have little white speckles, so white stains on your white teeth. So it's not really of an aesthetic reason, but you have to make sure, you know, that you don't have to overflow. Remember the TV commercials we used to have when we were kids? It was like, and it was like a whole bunch. You don't need that anymore. A grain of rice for the kids 0 to 3, and if they're at risk, and a small green pea size for 3 to 6. So it's barely, you barely need it as long as it's there. So we always tell them as well, again, it's integrations. So all of these messages that we have right here on this slide, it's actually working for obesity, it's working for diabetes, it's working for other chronic diseases. So eat nutritious snacks during the day rather than sticky snacks. And we've had the issues where when we talk to nutritionists and dietitians about the a nutritious snack being the sticky fruits like the raisins. Raisins are very nutritious, however, people need to keep in mind that it's sticky. It sticks to the teeth, so you have to brush your teeth after that because it will stick. It's filled with sugar. Nevertheless, it's good sugar within the raisin, but you still have to make sure that you brush with that. When you're pregnant or when you're a parent or when you live in a household where there are adults or teenagers who are consuming or smoking alcohol consumption, well, it's good to know because they need to know that they may cause gum disease and loss of bone structure surrounding the teeth, specifically when you're pregnant. So you have to be careful with that. Planning to breastfeed, but I'm not going to go through the breastfeeding because you guys are experts at breastfeeding and all what needs to be done. But we're also saying that breastfeeding is impeccable and it's great for gum disease and for tooth health. Also, when you talk about community children's program, the toothbrushing activities, I can't say more that the first initiative that you guys, if you think of something, it would be to reinstate a toothbrushing program. It's tough because the best ways that you can access many kids is through school system or through daycare, and even private daycare, but that is actually the most important intervention that you could provide to a child is the toothbrushing activity. It improves health, it improves motor skill development as well for your child while promoting healthy behavior as well. Following Canada's food guide, of course, and choosing healthy foods and beverages over those that have sugars can reduce the risk of early childhood caries. If you are living within a First Nation reserve, be conscious that they could use wild game as well, which is very nutritious. You don't want to change too much. You just want to make sure that they eat nutritious and they eat what they have on hand, but less processed food and less food, and of course the sweetened beverages. So it's those Gatorades, it's those specialty coffees from Tim Hortons, from Starbucks, you know, those ones actually were, when they had a public opinion research before undergoing the Canada Food Guide, for the kids, for the teenagers 13 to 17, the biggest one were the pops, but for the young adults, it was actually those specialty coffees. I was actually surprised because I think they're costly. If you go to Starbucks or if you go to Tim Horton might be cheaper, but if you go to Starbucks, they're like $5-6 a coffee. So I was surprised to hear that this was one of the main sugar intake for young adults. So we just saw the lift the lip technique, which is pretty easy. You as an intervention person don't even have to do it. You can just teach the parent how to do it, and they can do it on a monthly basis, and it prevents early childhood tooth decay, because as soon as they would see something that's not normal, you teach them what's normal, and as soon as they see something, this isn't right, they will hopefully get some access to care, and they will probably seek the services of an oral health professional. So it's kind of nice. So of the key messages, and these are key messages that throughout Canada, all the provinces and territories were happy to hear, is that the mouth is part of the body, and that's not just for kids and parents. It's actually for all of the programs, all the pediatric dentistry, us as dental people as well, that the mouth is part of the body. We in dental offices will also try to share common risk factor when we talk about oral health and gum disease. We also want to talk about diabetes and obesity. So it's vice versa. It's important for mom and the rest of the family to keep their mouths healthy, because cavities are infectious and they're transmissible to your babies. It's not really the cavities, but it's the bacteria that causes cavities. So it's very important for the siblings as well to make sure that they also brush their teeth. Lifting the lip. is a great way, a cheap way to ensure an early intervention is necessary, and it's very easy to do. Disrupting the plaque accumulation must be done every day. So when we say brush your teeth twice a day, floss your teeth, notice that we spent about 3 seconds in the 3-minute video to talk about flossing. It's important to floss, but for babies, most of the babies have spaces between their baby teeth. However, not everyone does. At that point, it's important to use the floss to disrupt the plaque wall that could be building between the teeth. It's the same for mommy, daddy, caregivers, for everyone. The last key message is it's not okay to lose baby teeth prematurely. So how often have you heard someone say, don't worry about it, you know, their baby teeth, they fall off anyways, you know? It's very important to keep baby teeth as long as possible because they will help maintain the space that is required for the grown-up teeth to erupt. So when it's time, there's going to be space for these big teeth to come in a very small mouth. And then you could end up with orthodontic issues if you do not maintain those baby teeth healthy until they normally fall off. Okay, so we have movie. We've done as much dissemination as we could. We have promoted the video. Just beside this is the office, CDA, Canadian Dental Association, who have made a little discussion video about the video so that it could be disseminated throughout Canada. But now you guys are also another way and another means to disseminate this small video. Actually, in Nunavut, in Northwest Territories, it's being used widely. Saskatchewan is being used. Ontario, I don't hear too much about Ontario. That's why I'm so happy to be here today, because you guys are going to be my, my doorway, my door of entry, my, let's go, penetration to the program. I'm glad to be here. Now let's talk about the resources that we have built at the Office of the Chief Dental Officer. You'll see below on the slide that, if you can keep the slides, on the bottom you have a link. And there's a link to 3 different tip sheets. They're one-pager that you can print and give the parents, or that you can go through if you do have access to your computer and you have access to internet. You can go to that link, and we have divided it into oral health tips for pregnant women, oral health tips for kids that are age 0 to 3 and 3 to 6. So these are pretty easy to use. You don't really need to be dental to do that. The reason that we have used this is because pediatricians were also asking about something very easy to be using. So these are very good resources that you can have, and they could be at hand. You can print a few and give them. If they don't, if it's not a piece of paper that they're not going to likely keep and, you know, throw out in the garbage, then actually you can actually talk about it every time you see the parents as well. These are links as well to community water fluoridation, which is a great mechanism to access everyone in the household. It's a cheap way as well to reduce the cavity rate. We have a position statement from Public Health Agency on the right side, and on the left side, it's kind of a small fact sheet that is very easy to use. It's in lay terms so that everybody can understand the science behind it and why it is safe and effective. So this is just for you to know. You may not want to go through this, but actually these are resources that you guys can use. The next one, because I'm not talking to the dental group, I'm talking to some of our nurses, dietitian, but a few years ago, we had a couple of pediatricians. Actually, the Canadian Pediatric Society came to us and they said, listen, our job is to look at babies during Well Baby Clinic. We see them 2 weeks old, at 6 weeks old, at 1 month old, at 2 months old, 6 months old. Yet, no, we do our job, but when we ask the kids sometimes to open their mouth, oh, wow, someone's not doing their job somewhere. So a year and a half ago, we have commissioned the University of Manitoba to establish and to create a tool. It's called an oral health caries risk assessment tool for kids under 6. So this is going to be a national tool, a Canadian tool that it's based on a 100-page report full of evidence, and we have put in there the risk factors, the 6 most common risk factor, and then they can establish high risk and low risk so they would know what to provide for the child. So we're now working with the, I'm not sure if some of you are familiar with the Rourke baby record, but we're trying to work with, we're working with Dr. Rourke to see if we could integrate some of the health factors so that people could assess their risk for that as well. So that's one way that we could do things in an integrated approach. By the way, that Carrie's risk assessment tool should be ready early spring. So I'm pretty sure that April is going to be, where it will be housed at University of Manitoba, but it's going to be for Canada. So if you guys want to use it, eventually I will try to send something to Sydney or CAP CCPNP to find the link for University of Manitoba. It's free to use, but you will have to log in and register to get it so that they maintain a list of people who are using it in case things change as they go. So it will be housed and it will be owned and managed by University of Manitoba. The next slide is if you know of any communities who are they're looking for a dental professional, so a hygienist, a dentist, a lab technician for dentistry, periodontist, if they need someone, this is like my dating game, I call it. It's called the Canadian Dental Connection. It's housed within McGill University in Montreal, but it's for the rest of Canada. So you log in, you register, you put your name if you're a dental person who would like to work in remote, isolated across Canada, and the community is also registered and we connect them together. So this has been launched in October. We already have over 3,000 hits, so it's looking quite good in there. So this is just for me to disseminate to you guys because there is something like that. And sometimes the communities have been struggling to find a dentist or a dental hygienist or specialties. And that's a great way to connect those people together. Bon. I'm hoping that we're going to get some questions in there because right now I have kept a few minutes so that we can discuss those issues. Any questions from you guys? Anything you want to discuss? I'm more than happy to share stuff with you.
Oh, great, Lisette, this is Sydney. So what I think I will do is unmute everybody. So maybe if they're not in, you could either type your question in the chat box or feel free to hello and to ask Lisette a question directly. Is there anybody who has a question? Lisette, I seem to have lost you on the screen. Are you still there?
I'm still there.
You are. Okay.
Yeah, okay. I'm still there. I just removed the presentation so I could see the group chat.
Oh, good. Okay. So while people are thinking about if they have a question to ask, I actually have a question for you, Lisette. First, wow, all this information was just so really interesting, and I learned a lot, and I was surprised by your stat about less than 1% of children coming in to see a dental health professional, both under the age of 1, I think, and under the age of 2 or 3. You said it wasn't until they get to be 4 that it creeps up a little bit. But what do you think are the barriers? What do you think is stopping families from being able to do that or accessing dental services with the really young ones?
Well, I think there are lots of barriers in there, and I'm not going to say that one is bigger than the other, but we've been told that cost is one of the biggest issue. Access to care is a big issue as well. So you kind of wish that, it would be nice to see some basic services being delivered from a a universal manner. Some people are trying, like I know now that, for instance, in the province of Quebec, they will now attempt to have a universal prevention for seniors in long-term care. They already have children 0 to 9 years old where it's basic and prevention. So the sealants are covered for, the checkup, x-rays are covered for in Quebec. Same thing in Ontario, you do have the Healthy Smiles, but there is I think it's related to the income, the family's income. So if your income is higher than X number, then you're not eligible for that. So sometimes it's based on the income. So these are some of them. The lack of knowledge as well. If people don't talk to people, and again, if you think that baby teeth, who cares, there's another set of teeth coming, we don't worry about that. So it's the lack of knowledge as well. So these are maybe the three that I could see. Social determinants as well, is oral health a priority if you are food insecure, you don't have a job, you barely can make ends meet. So it's more the cost still, but social determinants is really up in there as well.
Got you. I see somebody has posted, thank you for answering that. I'm going to read the question just so that everybody will be able to hear it. We have a question. Do you have any experience with breastfeeding messaging conflicting with oral health messaging around breastfeeding? Health Canada, Canada Pediatric Society, and BFI recommend unrestricted breastfeeds, cue-based, hunger-based feedings. However, the Canadian Dental Association and Ontario College of Dentists say that night feeding and frequent feeding is a risk factor for cavities. These conflicting messages can be a challenge for families, cue-based feeding versus restricted feedings for cavity prevention. So do you have any sort of comment or thoughts on that question?
Oh, God. I remember back in 2000, what was it? In 2012, I think I was invited to speak with nurses about oral health, and I got bashed by some of the nurses when I had a slide about breastfeeding, that breastfeeding is fantastic. You need to keep on breastfeeding. However, you should make sure that when the first tooth starts to go to bud, you make sure that you brush the teeth. And I never said anything about not breastfeeding. It's just that it is a risk because the sweets, the sugars from the breastfeeding milk may stay in there and attack the outer layer, the enamel of the baby tooth, because it's not as thick as the grown-up tooth. So that's all. We would never say anything about breastfeeding or against breastfeeding. By all means, it has to be, this is the best food, this is the best nutrition that a child can have. We just want people to be cognizant that oral health mechanisms, so the oral health practices, have got to be brought on board early.
Wonderful. Okay, thank you. And thanks
Yes.
for the question. That's great question.
Yes, please keep them going. Or if you guys want to talk.
Is anybody else, we'll give another minute or so and just see if there's any other questions that come forward. In the meantime, I have to admit too, I'd like to think that I wouldn't jump to the conclusion, Lisette, that don't worry about baby teeth anyway, because just a new new cycle will grow right in. But I might have fallen into that trap. Is that a very common misconception?
Oh, no, yes, it is. Like, why wouldn't you? And even when my mother and even me, can't really say me, but I've had issues with my own children in terms of oral health, and I'm a registered dental hygienist. With regard to, this is actually the only time that we have a double set of something in our bodies. So of course, people would say that. It's just when we tell them that it's important and it's not normal to lose teeth, then they kind of come to realize, when they spend sleepless nights with their babies who suffers from tooth decay, at that point they know it may be too late by then for that particular tooth, but you need to make sure that when they have siblings or when they have more children and they have done this with the first one, they usually come to realize that it's important to keep the baby teeth because of what I said, to maintain the space, because they need to be able to feed themselves as they grow up, because the second set of teeth is only going to be complete by the age of 12. Yes, they start losing teeth at age 5 and 6, give or take, this is textbook, at 5 or 6 years of age. But you've got the ugly duckling stage from 6 to 12 where they have a mixed dentition. So it's very important that they keep those baby teeth as long as possible. That's what I meant.
Well, thank you very much. I think we are going to wrap up. That seems to be what we have, and thanks to those who have joined us. And thank you so much, Lisette, for joining us and sharing your knowledge and your wisdom today. Like I said, I learned a lot, and I'm glad that we are an opportunity for you to start bringing your message more into Ontario, to share the archive of this webinar with our other network members and share some of those links and resources that you provided. So thanks to everybody who joined us today. It was great to have you here. I hope that you will join us for our next webinar, which is next week on January 30th. And the topic is FASD prevention. If you need more information about that, you can always shoot me an email, and I'll make sure you have all the information on that. So thanks, Lisette. I hope you have a lovely afternoon.
Thank you. You too. Guess what we're doing? We're going to go shoveling.
More shoveling, yes. So I hope everybody just stay safe and warm in all this snow.
Yes. Well, thank you very much for listening, and hopefully you'll get the oral health messages in there. Thank you so much for inviting me, Sydney.
It was wonderful. Thanks so much, Lisette. Take care.
Take care. Bye.
Bye-bye.